It all started when I was about 19, playing soccer. I had my front teeth knocked out, so I had a partial plate for 55 years or so. I had a partial plate in there, and it done the purpose, but it wasn't the best until they started coming out with implants, and I thought about it for a few years. And then I finally got implants on the roof of my mouth, but I had to go in and get bone grafted. So that worked out pretty good, and then I come over to see Dr. Sheri and thought about getting the rest of my bottom teeth removed, which I had 8 removed, to get implants on the bottom, and it's been really good for me. The looks filled out my face a little bit, and I can eat anything. That's what's good about it. They look better, they feel better, and I think that was the right thing to do, and I'm happy with it. And I was always breaking my teeth. I was always going in, getting them fixed, breaking a tooth off, and you know, getting adjustment and this and that. So this has been a lot better for me. I had to think about it for quite a while. Yeah. And then my dentist recommended it, and I took notice of it, and took notice of what they said, and it was the best thing I ever done. Yeah, I couldn't eat an apple. I couldn't eat a steak. I can do all those things today. I can do anything with these new implants. They work just great.